Well, good afternoon, everyone. Shall I just I'll explain what I'm going to do, and then we'll take it from there. So, in effect, what we found was that there's been incredible barriers between the public and private sector. So I've never really had a proper job. So I've worked in local government, and I've worked in the charity sector, and then I've worked in the NHS for over a decade. And during that time, although the private sector and the public sector work quite well together on many occasions, there's often been a tension between them that means, particularly in a job like innovation, where you're working across those barriers, it can be quite tricky. So, but actually, what we found was that COVID was the one thing that absolutely smashed through it, because it was based on necessity. So I thought I'd take you through some of the experiences, and then we'd pick up some questions at the end, really. So if that's okay. So if somebody else is turning the slides over, can we go to the next slide? Brilliant. Okay, so I'll just start with, so the Walton Centre's not the, somebody did describe it to me as the best kept secret in the NHS. And being rather selfish, I'm rather happy that it is, because in effect, it's an extraordinary trust in the sense that it's a specialist trust, so it deals in brains. In effect, it's a neuroscience centre. It's the only standalone one in the country, and it does 5 things, just so you understand. So it does neurosurgery, brain surgery, spinal surgery, does neurology, which is all conditions of the brain, so things like epilepsy, dementia. The most common condition we do is headache, which is the biggest single form of disability, non-physical disability in the world. And we at the most numerous consultants are in the field of headache. There's a whole world of really difficult and complex conditions like thunderclap headaches and things that you'd have no idea about unless you were involved in it. We also do pain, which runs on a spectrum from physical pain to completely psychosomatic. Most people are somewhere in between. This is quite interesting and relevant to where we're going. So if somebody's, had a failed relationship and under the knee at the same time, are they drinking or are they addicted to prescription-based drugs or opiates? What is the cause? And often the initial clinic can take an hour to unravel what's the cause of this person's pain. And then the final bit is rehab, but probably it's actually complex rehab. So it's rehab, not perhaps as you know it. So it's a rehab in terms of, so our average length of stay is 100 days, but certainly in my time here, we've had people stay for a year. So there's often where people have been incredibly smashed and got to be put back together, or indeed we've got it's a consequence of a neurological condition has meant that they basically got to learn to walk, to sit up and walk again. So that's what we do. We've got 3.5 million as our catchment area. It's clear on there where we are. So I would say, because we employ a lot of specialists, so you can get an incredibly rare condition, we'll pick people up from often anywhere within Great Britain, but it's not unusual to get people occasionally from Europe. We've got about 1,500 staff, and as a consequence of the way we are, we do the most kind of like surgical cases of any kind of same or similar centre in the country. Next slide. This is just to give you an idea of obviously we partner. So interestingly, we've got a charity on there, which I'll come to. But we're involved in lots of partnerships. The main thing is we're next door to a giant hospital. We have a helipad on site. If it's neck or spine, they come over the bridge to us. But we run the rehab network, but we link in with other independent charities like the Brain Charity. So it's a highly specialised environment. It's well known locally, and nationally it's known. I'd only say that. So should somebody got quite high profile, I don't know, an MP or one of their friends have a skiing accident, they might find themselves in our hospital environs. Okay, next slide, please. So, COVID-19. So, I really just wanted to sort of set this up, really, in terms of, because this is all kind of fresh learning, and in terms of, like, what's the problem. But in effect, what COVID-19 did was it, I'll talk about the problem in a second, but what it did do was it kind of crept up on us. I have to take you slightly back, because most of you will be excited that the pubs and things are reopening. I'm still quite annoyed that the gyms aren't, but we'll come back to that. But in effect, as it kind of emerged, it emerged in quite a slow, it unfolded in quite a slow way until we got to Italy, which is on the next slide, which we'll come to in a second. But what we had was, we had all our supply chains were based upon manufacturers abroad. We had, I think it was Malaysia or somewhere, were the biggest manufacturers of face masks. There was a kind of whole range of things that were no longer produced locally because we'd been driven by price. And there was a model of procurement in the NHS that was based on something called category towers. So there was an inherent tension as COVID-19 kicked in between our need to engage locally. So that would be, so let's take loo rolls, for example. Loo rolls, do we go for the cheapest price and we end up going for Budley Salderton loo roll company, or indeed a Chinese loo roll company? But we do that collectively as the NHS on our patch and put Merseyside loo roll company out of business. And it sounds slightly spurious, but none of us had really thought of it in that way. What we thought about is, if we can get the quality, we can get it, doesn't matter where we get it from, because we need to drive down costs and make efficiencies. And of course, COVID came along and nobody had dealt with this before. And just to set the scene, so even amongst the consultant body, there was a spectrum. There were some people who were thinking, wow, this is really terrifying. We had another group of consultants who were going, it's just another cold. Okay, so next slide, please. So just to take you back, so it's only 3 months ago, the deterioration in Italy and other European countries really created that sense of suddenly we were alone. There was a unique climate of concern, particularly around the way that people were still relying on things like NHS supply chains, when actually some hospitals that perhaps had more of these or more hand sanitizer than others might have been holding on to it. We at the very least went to regional kind of view of looking at it. We were running out of PPE. That's quite high profile, but actually there's something, I suppose, really to say about the problem as become the solution. So some trusts have taken the view that they would only use certain masks. So, and of course, if you specialised, you only used a particular one mask manufactured by one company, even if it was a big global one, you had then reduced your ability to diversify and respond. The supply chain was clearly overloaded, and we took the view quite early on that we couldn't rely on that. And then we come to the traditional barriers between the public and private sector. And what that actually meant was that in some cases we had some incredibly immature views of the private sector. I have to admit that we work a lot with the private sector, but there was still a political view that public sector good, private sector bad, when of course in reality everyone was working together. And frankly, some private sector organisations have thought, your bureaucracy around procurement means that why would I consider supplying anything to you? And then of course we've got the final one, which I've called rigid industry standards on the slide, but could be said we've set European or we've set British standards of compliance that we expect you to meet before you can supply anything to us. So, and let me tell you, this won't be dry because there's been quite extraordinary things have happened. So, next slide, please. So I should say thank you, Neela, for that. So, let's then start to talk about. So, one of the things we could talk about is scrubs. So, what we then realised was that we were getting to the point where supplies were so low, all we had was local manufacturers on our patch. We did not get hung up on things like industry standards. And I'm not now joking. There's something about if what we've got. So we had a group of people who made handmade masks. Did we take them? Yes, we did. Because the choice was a handmade mask or nothing. We wanted our staff to have handmade masks. And that was very much the deal that we entered into. So scrubs, these were supplied by Liverpool Sewing Ladies and Help Dress Medics, which were both community organisations. You'll see, well, the male model in this is actually one of our top consultants, but they manufactured them with the Liverpool football logo. They were crowd-funded, and we are a cutting-edge trust. Where in some cases we've got some of the, not merely the leading consultants in the country, but easily the leading in Europe. So I have, I still actively recruit consultants from the States, from India, from Germany, from the real hotspots of neurological excellence. So literally, we were taking these have been made by people locally, we were brought in, we'd wash them, and off we'd go. And that's what we did, because we didn't have enough scrubs. And just to be really clear for people, so we've got most of our neurologists don't do theatre work, they don't do surgery, so they would not have scrubs. They did clinics, they'd look through people, they prescribe drugs. If there was surgery, they'd hand over to the 20 or so surgeons that we had on site. So that's why that mattered. Next slide, please. Oops, I'm probably doing this. So face masks, I've kind of alluded to that a degree, but I just need to be really clear that, like, we had people hand make stuff, we went and collected it and we put it in our stores, because without that, some trusts were like a day or two away from running out. And if you think back to that time, because I haven't actually worked from home, I can remember what that was like. I could do Manchester to Liverpool in like 40 minutes without breaking the speed limit, I hasten to add, in case, because I know no idea dropper done quite a lot with the police. So I just need to be really clear. It was that kind of, it was like being in a sci-fi film in the early days driving on here. And we were on our own. And do you know what we did also was that sometimes if we got really good on, say, visors, we'd share that with other trusts in the area. But because we diversified, we could use any face masks. Some people who hadn't, we really had to share with them. And those are really good examples. Those are handmade masks on the screen there. There were some that were like literally made out of sheets. Did people use them? Not many people did, but actually we needed them. We were that far away, in some cases 2 days away from using them. Some trusts clearly did. And Ela, if you could share the next slide, that's great. Right, so this is a really great example. This is a company called Does Liverpool, an innovative, a local SME. They literally 3D printed visors. And they supplied, I actually had to write to get this stuff in. So they supplied to the region, so across our region, they supplied 24,000 visors since March. And what they did is they did two things. They basically 3D printed the thing that goes around your head. And an industrial standard kind of visor, you clip in a quite a thick visor. But we were literally, for those of you who are old enough, and I hate to admit that I am, clearly I don't look it. I'd like to say that. So in the right lighting, I can pass for 55 and a half. I'd just like to say that in my defense. But literally, you take an acetate, think how thin an acetate is, clip that in, but actually that stopped any spittle or anything coming through to you. So COVID, so at the height of it, and we still have COVID patients on site. Remember, we cleared out all our old patients, we stopped a lot of business as usual, and we had COVID patients, but clearly we were still dealing with, there's a crash, they would helicopter in people, and we'd have those, via A&E. And also, in order to make room in some other parts of the system, we took all the stroke patients. So we had a very huge number of stroke patients who we tried to, again, because it kept them in a separate building to keep them isolated. But literally, this stuff saved lives. And someone like Does Liverpool was desperately trying to get in, couldn't. And do you know what? They got in, and they clearly helped and saved the lives of some of our staff. And it fundamentally changed the relationship between how people feel about the private sector. So that's really interesting. And one of the things I would say is, having worked in local government, I worked in Trafford Council amongst others. I would get in a cab working for a council, and I wouldn't tell anyone where I worked. Round here, people they do like the NHS, but they particularly love the Walton Centre. And I've actually had offers of not to pay for the cab because you saved my mum's life or whatever. I have to say, as a back office Johnny, I never take advantage of it, and I always queued up at Tesco's in case anyone thinks he's that bloke in the suit who ran in front of me. I definitely never did that. So, Neil, if we could have the next slide. This is particularly amazing stuff. So, hand sanitizers. So, hold on to your hat for this. So, we've got all sorts of companies got involved. INEOS, I think, are a chemical company. They have a big investment arm. Konix. That's a picture, I think, on there. We had a local gin company that you've heard about it anecdotally. The local gin company manufactured it. Obviously, high levels of alcohol. So you'll be glad to know, and this is now not a joke, I got the latest figures through. I asked, have there been any problems with the hand sanitizers? Do we think there have? There's been 5 to my knowledge. We've had 2 cases in the Northwest of hand sanitizers with huge levels of alcohol in a car on a hot day. Can you guess what happened, people? Bursting into flames. My favourite example is 3 people. Now, no one's been damaged in this, mainly ambulance drivers, but we've had 3 people, certainly on the Merseyside patch, who are wearing obviously plastic gloves, latex gloves, sanitizing their hands as you'd expect. So they're coming in or going out. They're sanitizing their hands. They haven't dried all of it off, and we've had 3 cases of, as they've touched the car handle, that the gloves have caught fire. They've had to whip them off really quickly. But to be honest, that's it. If you think about, for nearly the last 3 months, I've not seen a regular manufactured sanitizer. We couldn't have done it without. In fact, I will just be cheeky and grab one off my desk. Hold on. Just to give you an idea. So I've got some of the later stuff, but this one, just to give you an idea, because I'll do this, it's virtually liquid as it comes out. What I would say is it just smells purely of alcohol. And to be honest, so we've had a few tiny mishaps like that. We wouldn't have had sanitizer if local companies hadn't switched. So I've laboured that point. There are, okay, so it's not completely conformed to standards, and clearly you'd have a lower level of alcohol in something that's sold commercially in Boots. But these genuinely were lifesavers. So, and we've had a few mishaps and a bit of excitement, but beyond that, we're okay. Anila, can we have the next slide? General shortages. So, and this is something I really wanted to kind of like share with you, because so what we've got is a hospital with patients in it. And if you were seeing empty supermarket shelves, we were, how do I get basic stuff? How do I feed the staff who've come in? And things like deals with Domino's and stuff were really important, because actually there was you forget very quickly that actually I can remember being in Tesco's and thinking there's no pasta, and you'd walk down kind of empty rows. So a lot of it again was about local manufacturers or local suppliers who could guarantee they could get the food to us and could drive it through us, to us. Toilet roll, we didn't run out, but like when you run off, in fact, I have a luxury roll, which I'll show you. During the crisis, the only roll I could get at that point was actually, for those of you who can see it, it's a Donald Trump toilet roll that was kind of given to me. We took anything, I just not. So basic food, feeding people, and toiletries. So we have a charity, and we were local. Some of the companies have just been bloody brilliant. So people were donating Avena. So that's a hand cream. So of course, actually, people who are using this all day and cleaning their hands 20 times a day need hand cream. Whereas someone like me, the worst I get is I might get a slightly sore finger pressing my QWERTY keyboard too hard. But it was really appreciated. Cadbury's donated just chocolate and things. Local footballers donated stuff. It was amazing what a difference it made, and particularly where people were doing much longer shifts. We have more people sleeping on site than ever before. It really made a difference. And then the charitable donations have been amazing. And just so you know, just so you can pull it all together. So, do you remember Captain Tom going around his garden raising all that money? That then came through. So someone like that here. So in this trust, we got about around 45k through from that so far. That paid for 2 weeks for not everywhere, but on 2 separate weeks. The canteen food was completely free to our staff, and it was really appreciated. That kind of and that actually makes a real difference. Amazingly, I don't know how we're going to get out of this one, but car parking's been free because A, it's been quite empty, which has been great, but B, it's been really important in terms of people who work here live in the area, so if they're worrying about feeding us, we've got to get them in, and so things like we don't want people faffing around for loose change, in a car park, and that's been an absolute bonus. And in fact, I surveyed the staff, and we had like a third of the staff respond. Some who'd worked here, and some who'd worked from home, because we sent a lot of the back office staff home. So all my staff work from home, apart from me and a couple of people from the charity and a couple of people also over research. And we've done 3 COVID studies. So apart from those, everyone else is at home. And the top things that came out were actually, isn't it nice to be given something at the end of the day? And in fact, I don't know if I put a Project Wingman slide in, I don't think I have. So one of the most amazing things that's going on here at the moment is something called Project Wingman. I don't think I did a slide on it, on that at the end, no I didn't, which is a group of first-class cabin crew. It was on the news last week. I've set up a first-class lounge, and we're getting 200 staff a day going in, so they're kind of furloughed and in some cases unemployed now, cabin crew, who've just been making staff feel better, making them cups of tea and coffee, giving them biscuits and stuff, and that's been a really lovely kind of additional thing. And I can't explain to you, just down on the COVID wards, it has been so intense. Everybody, with all the kit on, dealing with people who it is life or death, and you're terrified of catching it yourself. So next slide, please, Anila. Yeah, now e-consultation, so completely separate to this. So I've kind of set up, I didn't really labour the fact, but we've now massively increased our home working. But what's really accelerated, we were moving at a tortoise-like rate. Now what we've got is, at the beginning, I was sharing with you that we've got quite a wide span. So we treat more people in North Wales than in Liverpool. We do the Isle of Man, we do these areas. Actually, e-consultation has absolutely taken off. And so a lot of my consultant colleagues are literally, going off into their office and doing a clinic in this way. And literally it's gone from a few of these to massively accelerated. And I wasn't going to go through how it works, but I was going to let you know the driver, because you're 7 times more likely to catch COVID in a hospital than somewhere else. So people just didn't want to come in. And it's really meant that, so in effect, our patients or our customers absolutely didn't want this. That's gone really well. That's accelerated, and we've been able to crack on with that. You can get a nice feel for it. Neil, do you want to do I think we've got a couple of slides left. Next slide, please. And then just a bit about, I think, teed this up just to say, when something like this happens, what you're left with is what you've got in your local economy, and that's why some of these links have been really, really helpful. I have to say, Andrew, who's going to do this presentation, we can't make it. There's a social crisis, social care crisis, whichever way you want to describe it, but clearly the social care issue. So at the moment in Liverpool, we have 1,600 vacant beds in social care across Merseyside. before this started, you were on a 1-year waiting list to get one, because people have seen that social care is a really dangerous environment for COVID, and people are pulling people out. Final slide, please. Maybe one more for the question slide. Yeah. So, there's just 2 more, isn't it? Right. So just to be really quick on this one, the cure. I'm not being flippant about this, but clearly we're going to have a, nobody is under any illusion that we're going to have in the short term, we're going to have a depression. And what will that mean for all sorts of other, for those of you, again, I am old enough to have been around in the early 90s when, 3 million unemployed, kind of mental health issues and all the other addiction issues and things that come from that. All the problems with social and economic deprivation. But actually, one of the real things that's come out is this has really blurred the lines between the public and private sector. Next slide, please. Anchor institutions, just thought I'd draw this to your attention. We're an anchor institution, which is we recognise our role in the local health economy. We look to employ locally. We look to supply locally. We'd only just committed to this, but longer term, we really are. It's crazy that we would be getting our sandwiches made in wherever, Gretna Green, and then transported down here overnight. And it has all those environmental benefits. I would also say, as somebody who leads on, believe it or not, I lead on medical innovation because my background's OD. So I get loads of clever people and get them to try and agree on how we're going to manage the change. But I'd much prefer having a local manufacturer, because if they're manufacturing, I don't know, exoskeletal robotics, I'd rather have someone round the corner that can drive over to and grab by the short and curlies and say, I've got a problem, rather than have a manufacturer in New Zealand that is remote to me. And I think that's the last slide and leads us into questions. There we are. Thank you.